Despite humanity's advanced medical developments, 11 Coachella Valley farmers died of the flu in 2019. With no apparent health records, authorities speculate that they've never been vaccinated or received any paid healthcare service. This is the same for most Chicano farmers nationwide, despite working relentlessly to feed the entire country. Coachella is best known for music festivals, affluent homes, and the scorching sun, yet farmers have been there long before Coachella became famous. Since the early 1900s, Latinx farmers in the valley have been populating. Since then, these farmers began protesting workers' rights as the United Farm Workers Labor Union, led by Cesar Chavez, advocating for several rights, arguably the most important of which is healthcare. Today, the UFW continues advocating for better, cleaner working conditions for farmers nationwide. The UCR School of Medicine also advocates for the group through mobile clinics, providing vaccinations, annual checkups, and treatments for ordinary illnesses such as asthma or diabetes. However, some farmers' needs that have yet to be addressed are living and working conditions. Farmers at Coachella seasonally live in mobile trailers because the crops they cultivate grow seasonally. This makes them disposable to companies that only employ them during cultivating season without stable residence, income, or healthcare plans. Additionally, farmers are being further exploited by said companies because they get scarce drinking water supply, rare breaks from the scalding sun, and continue working amid wildfires annually rampaging the Central Valley. This exposes millions of farmers to dangerous smoke inhalation, from which other residents around them flee, fearing permanent lung damage. While these inhumane conditions have been ever present in the lives of Coachella Valley farm workers, the pandemic substantially exacerbated them. The Latinx population nationally experienced double the risk of infection and 3 times the risk of death due to COVID-19. These rates skyrocketed in eastern Coachella. With essential farmers unable to work remotely, they should have been prioritized to access vaccines and provided with masks, gloves, and daily wellness checks. However, that's not what happened. On top of being low priority for vaccinations, several farmers in Coachella were actually weary of obtaining vaccines. This is not only due to diminishing health literacy in eastern Coachella, but also the neglected language barrier between Mexican or indigenous farm workers and English-speaking healthcare staff. Ultimately, farmers that provide us with our most essential need, food, are not receiving another equally essential need, healthcare. Though the UFW has taken giant strides towards labor equality, until migrant labor ceases to be racialized and disposable, essential workers will remain marginalized in healthcare access and will continue falling ill and even dying more frequently than more valued groups in the country. It's no surprise that Latinos are much more susceptible to coronavirus because historically, the US government exploited them when their labor was needed and abandoned them when their labor was not. Therefore, we must unite, urging all government levels to provide undocumented farmers with the healthcare they deserve, because blue-collar immigrants cannot continue doing the nation's most backbreaking work, yet being the most marginalized people.